But thank you again for having me. I think your resources as a group, what you can offer one another, just as evidenced by Katie's question, going online and being part of the AIH Connect patient registry and the support group and any other fora where you can connect to other people who are aware of or experience autoimmune hepatitis, I think would offer its own very valuable resource. So when you're experiencing a rare disease, not only are we aware that this, of course, happens to fewer people by definition, but it can have implications for resources for treatment. It can also have psychological implications. And the research in our field shows that this, unfortunately, presents increased risk for people to experience social isolation, where they may feel lessened support or less obvious support from others, emotional distress, and even, unfortunately, some stigma. I think some of that may stem from lack of awareness in the community about autoimmune conditions in general, and then specifically autoimmune hepatitis. I think the hepatitis became stigmatized a few decades ago when people associated it with other health behaviors that may have posed risk for people. We know that those are not an issue or relevant for autoimmune hepatitis in the same way. And regardless, we would certainly hope to help increase public awareness about what the condition is and specifically how that affects people so that they could ideally be of better support. So I'm going to talk today a bit about, I understood the interest was around some of the symptom experiences of fatigue and mental health impact. QOL, as I'm sure you know, and stands for quality of life. That's something, and by the way, I have not only treated these conditions, but I have an autoimmune condition. And so to have some of these symptoms up on a screen, it may feel fairly impersonal, like, oh, well, this is just something we list out or we research. I know that these have tremendous impact. Fatigue by itself is an enormous part of how our immune system functions and the energy it takes to keep that going in a good place. Daily life takes a great deal of energy. And when fatigue is a symptom overtly of a condition, especially autoimmune, that can have profound effect on our ability to get through the day, to maintain relationships with others, to keep purposeful focus, whether that's professional work or other activities. And so please know when I speak about these, I am aware on a professional and to some degree a personal level of the impact of these. So I'll talk about them briefly at a higher level in terms of research, but I'd like to hear from you about what this has been like from your perspective, whatever you're comfortable sharing. I would add that the recent research, unfortunately, supports higher risk for these symptom impacts for females, and it is a present risk whether or not some of the medical features proceed into manifestation. So in other words, just by virtue of having the condition, unfortunately, these symptoms can be present. I want to back up and contextualize wellness. When we talk about this in our field, we're not only thinking of health challenges like the symptoms I mentioned or work to prevent or mitigate them, but proactively, we'd rather think in terms of something described as a saludogenic approach. That means health focus or positive psychology emphasis to approaching ideal wellness, meaning considering a number of different facets of our well-being or our state of core self, are factors in our lives that impact that core self, like work, sense of wellness, finances, mental and emotional wellness, social and relational wellness, and then, of course, medical experiences. So we want to pay attention to that, not just when we're experiencing negative life events or certainly in crisis. Obviously, we want to be attending to it then, but also proactively when things are less acute. And I want to contextualize wellness within, as this diagram shows, kind of a broader lens where we would see the resources that are available to us individually, not in isolation, but rather in the context of ideally support kind of like concentric rings. If you threw a stone into a pond, you would have rings that spanned out. So you might have next your immediate community of support. That might be family, friends, primary relationship. And then in the community, that might include certainly the support group, how you all are being present to one another. It sounds like at least quarterly, which again, I think is phenomenal. Additional community support can include your healthcare providers, both for mental and physical well-being, because mental health is health. And additionally, other resources. I know IU Health certainly has a number of them available through dietitian support, social work, etc. And if you live outside of the IU Health treatment immediate vicinity, your own local medical resources at a minimum should offer some of these as well. By the way, one comment to share on this before we go on. There is a line in the literature around wellness and burnout. Burnout's like a condition of exhaustion after giving for a while. So that can happen for healthcare providers or for private support people, or just workers in their own lives. There's a line in that literature that says, beware the con of individual resilience. That is intended to say, we don't expect any one person to bear the brunt of the responsibility of being well on their shoulders alone. We recognize that while people have individual resources, they should also have access to, almost as a right, the resources of their local support system as well as the broader community. In other words, you're not going this alone. And so part of the reason I felt so honored to be asked to talk today was to be a part of that support team for you. So I would humbly offer to include myself in that ring of community support. So with respect specifically to autoimmune hepatitis, recent research, including with our own IU School of Medicine providers, such as Dr. Lammert, looked at the negative impact of quality of life on different facets of patients' lives, including work, relationships, the socialization, the degree to which they could engage in leisure activities or other activities of their choosing, as well as health habits like diet and exercise. And they found that even with excellent medical management and biochemical control of the disease, that patients were at risk of having this negative impact occur, particularly the longer it had gone on. In other words, with disease duration, no matter how well you were doing medically, these challenges continued to present themselves. And so we want to take a little bit closer look at that and what that might mean, as well as ways that we can intentionally try to counterbalance that with efforts and skills at coping. So symptoms are very wide ranging. Fatigue in particular, I know is a prominent symptom that greatly affects quality of life and has received appropriately increased focus and research. They kind of categorize symptoms in two ways: central, meaning brain regulated. So that's fatigue is conceptualized that way. Mental health symptoms, depression and anxiety are conceptualized that way, and so is sleep. And by the way, we know that it's not that simple. It's not just regulated by our brain. There's something called the brain-gut axis that's like, this is overly simplified, but it's like a two-way arrow between our digestive organs and our brain. We actually know that experiences like depression and anxiety are not isolated in the brain. In fact, serotonin itself is a neurotransmitter implicit in the mood experience, for example, and it was discovered as predominant in the intestines. So we know that other organs have a great deal to do with how we are experiencing things. And so we conceptualize this as more multifactorial or coming from different places in the body. But just for simplicity's sake, they're categorized as central. And then peripheral symptoms such as joint pain, abdominal pain, or itching, which is miserable. I think itching is often underrepresented in terms of focus as a symptom affecting quality of life. But I've heard many patients say they'd rather have pain than be itching. It can just be really, really awful to deal with. So I want to speak to for just a moment how profound this is. I found a quote within one of the studies where a patient described, like a qualitative survey of patients described symptoms, and one patient said, excuse me, the fatigue controls my life. It's described as much more profound than fatigue. People without these autoimmune conditions might say, oh, kind of like fatigue after you have a baby, or fatigue when you don't get a good night's sleep for a couple nights. And this is described in the literature as significantly beyond that. In fact, profound is a word that continues to come up over and over again. I don't know if anyone cares to comment on how they have experienced fatigue. I'm seeing a few smiles on the our cameras for those who have the cameras on, but that's a keen observation. The tiredness is like energy expenditure, but fatigue is a state of being, right? It stays with you and can be really frustrating, especially for people who are focused on, like goal productivity, trying to get something done, or referencing how they felt before their bodies changed with these symptoms, which is a really human experience, right? We're prone to those kinds of mental comparisons. So that's really normal to have that experience. Here it lists as well challenges with ADL. So that's activities of daily living, things like washing the dishes, washing your hair, just trying to get through obtaining food for a meal, much less cooking. So some of those activities of daily living can be especially distressing. Worry about your health experience as well is something many people endorse, feeling. That is something I specialize in as a health psychologist, and ranging from cancer to people with IBS or just transient difficulties. IBS is not transient, but other transient difficulties. Yeah. So having health worry about your condition, particularly around the time you may have interaction with the healthcare team, whether that's getting labs or seeing the physician for an update, that can provoke a particular type of anxiety. So I wanted to acknowledge that, as well as what I describe here as circular symptom exacerbation. That's a lot of heavy words there, but that means I usually draw this out like kind of like the recycling arrows would go in a circle. So sorry, my pen is tiny, but you would see symptoms basically exacerbating or perpetuating one another. So sleep can tend to work like this. Emotional distress as well, where if you are feeling frustrated or low or worried, that will tend to, this is just one dimension of it, but it will tend to take up energy that without those feelings might be used for other things that can then erode, for example, productivity or your ability to stay focused on things, which can then increase frustration or feeling overwhelmed or feeling sad. And then in turn, as you feel that, you may feel reinforced, like, see, indeed, I do feel this way, or it's not getting better, or I'm not able to get anything done, which can then in turn further reinforce the thoughts and feelings that you were having in the first place. Sleep is a particularly crucial element that can make an enormous difference both in coping and well-being, and then in symptom exacerbation, particularly pain and fatigue. And so that may seem obvious that sleep and fatigue are related, but it's not the only factor that makes a difference with fatigue, but it can, of course, exacerbate it, make it worse. So these are just a few more features of what I found in the literature around fatigue. This was on the Harvard website, constant exhaustion that makes it hard to get through the day, let alone participate in activities that you enjoy, and can be, as I mentioned already, compounded by other problems. Internally, they don't understand from a medical standpoint all the factors that can create this fatigue. They know inflammation may be related to it, but it's still something being investigated. I want to be sensitive to our time, and I could give a whole day seminar on this, because I think this is also interesting and important. But if we think of those reciprocal relationships, like recycling arrows going in a circle, all of the features that I listed here on this slide can have kind of a synergistic effect on one another. And I drew out the kind of like flow arrows that you see below to map out another way to conceptualize their relationship. But briefly, fatigue and mood can be reciprocal as you are, for example, weighed down with low energy and a persistent feeling of heaviness. I had a patient say to me today, I'm not sure that I can get through my day. For some patients, they're not sure that they can get through an hour, much less a day. And as they focus on that frustration, or they may feel easily demoralized, which can in turn lower mood. Also, when we do less activity, that can, the obvious relationship with activity most people might think of as overactivity leads to fatigue. But underactivity can also lead to fatigue. If you aren't doing much of anything, your body doesn't have the same signals for arousal, and that can lead to increased depression at times and or anxiety, which can then unfortunately reinforce some of our behavioral choices like low activity, although understandably that's affected by medical factors, physical factors as well, like feeling fatigue or feeling pain. Mood and activity, of course, are reciprocal in the sense of lowered motivation occurs when we are not engaging with things that are, I believe Freud and German had the phrase work and love, which I take to mean meaning and purpose, or I'm sorry, reverse, purpose and meaning. So work meaning something purposeful that gives you a reason to get moving, something you would like to see accomplished. And then relationships can give meaning to life. So when we are not engaged in socialization or goal-oriented activity, it can at times be a mood, a downer, like I was going to say the opposite of a mood booster, a mood hamperer, and can create increased anxiety. One way is through creating challenges around the less you do something, the more inhibition you may have to do it again. So you may get anxious when you're out of habit of doing something for a while. You also experience a cycle of lower motivation. So as you pull back from things, for example, if people aren't feeling well and they stay home, they tend to be more likely aware of their symptoms, which in turn fuels a feeling of often demoralization or distress. And then that may make it more challenging to get motivated. For other people, that's not at all the experience. They may take their time out as a way to kind of recharge, and that may in turn fuel motivation for them to get back out and do things. But I see that work both ways, reciprocally with patients. And then lastly, I'd like to mention anxiety and activity tend to go hand in hand. Anxiety and focus often are kind of like this. So as we feel, it's kind of chicken and the egg, so I could start either place, but since I had it in this order, I'll start with worry. As we feel worried, it actually diminishes our ability to stay engaged with a focal point of activity or cognition. And so as it does, it's like fracturing or diffusing at least our concentration, and with that we tend to get less done, which may in turn fuel our worry or feeling of being scattered. And with that scattered feeling, we often, this is just one substrate, but we get less done, and then it can fuel worry. So we sometimes with anxiety, I'll see patients get kind of bursts of activity, but it often feels less focused to them. None of these are meant to be universal descriptors. These are just examples of how these factors can interrelate. So what do we do to cope with these? Knowing that these are risks or these are challenges, how can I help support you and with, I hope, helpful suggestions on what as a field we know may be useful, and personally as a clinician I find helpful with my patients. The first thing I would add beyond kind of, some education on what the risks are and how we understand they interrelate is to layer a statement of self-compassion and acknowledgement. These are extraordinarily difficult experiences. I just want to pause for a moment to let that sink in. My heart is with each of you as you are facing this. I'm sorry that you have these challenges, and I would speak on behalf of our team to say we want to leverage every resource we can to help you in your efforts to stack the deck as you're dealing with these experiences. Layering that compassion on for yourself may or may not be, but I hope not, but may be more challenging. For many of us, we're harder on ourselves than anyone else ever could be. And especially for people who are goal-oriented or focused on productivity, the fatigue is a particularly painful symptom because it erodes our feeling of being able to get at the things that we want to be doing. And as we have less doing, often our minds can kind of ramp up and focus on list making or goal production, like here's all the things I want to get done. And then we focus on, especially those of us who have perfectionistic tendencies, and I absolutely understand that firsthand. Lots and lots of people who are goal focused do. And so perfectionists or people who are goal focused tend to focus on or at least highly achievement focused, tend to focus on the part that's not done as opposed to what has been done. So let's say you're able to get up, let's use the example of having challenges washing the dishes. My guess is that since our great participant offered her experience, I appreciate your authenticity and vulnerability to offer that today. My guess is that there were probably lots and lots of things that actually she did accomplish in the day. Probably many of them went under the radar of awareness and focus on, but I haven't gotten the dishes done. As I see those sitting near the sink, or as I see the, whatever piling up that's on my to-do list, that is easy to have that occupier focus, and the other accomplishments shrink in their importance. As I mentioned earlier, often we're harder on ourselves than anyone else ever could be. And so shrinking in our own awareness can be particularly challenging because that's where the voice may speak the loudest, right? Your own internal narrative in your head. So trying to layer in compassion and acknowledgement that this is hard, this is expected to be hard, and you're probably doing far better than is easy to recognize. And that's where some psychological strategies may come in to be of use. The research suggests proactive management where possible, meaning to plan ahead for your activity, make priorities for what's most critical. For example, sticking with the fatigue example, if you run out of energy, what you may want to make sure you've gotten done first versus what's discretionary or dispensable. I often, back to this diagram of the flow, like the idea of a peak up and a peak down. When we talk about managing peak attention and energy, if I go back to that slide, I often recommend patients identify the time of day where they expect to have better focus or better energy so that they can plan for those peak windows and front load their more challenging activities during that time. For example, in my day, I have a wide range of tasks I'm expected to do. My favorite is being with patients. So if I were to just plan my day, I would never touch email. I would just only be in session with people. At some point, I have to get to my email, however, and also have to do some what we call executive functioning thinking. That's like frontal or order thought like analysis. I'm just gesturing here because it's physically in the front of our brain. That kind of thought requires more effortful activity from our brain. It's more complex thought. And so I would do better to front load that at my peak time, which is usually around late morning, mid to late morning, lasting maybe just past lunch to, let's say, 1 o'clock or so. That is my optimum window of the day when I'm going to be able to do my complex thought. So after my first couple of patients, let's say I got a cancellation around 10 o'clock. I would not do well to start email or something that's like, more mundane or not requiring as much complex thought, because I will run out of gas later in the day. And at 4 or 5 o'clock, I will not have the same level. Now, today I was excited to present to you, so you're seeing me with more energy. But on many days after a full day of seeing patients, I may not have the wherewithal to give my research, for example, the same degree of analysis that it deserves. So I would do better to front load that activity in the morning. Similarly with physical activity, if there are things that are more challenging for my body to do, where I can help it, I will try to front load those things. So some patients do better managing showers in the morning. That's actually a fairly complex activity that requires a little bit of planning and some effort to get through. For other people, they do better after a bit of rest to manage that at night, and then use that in tandem with some sleep strategies to try to help them get down for the evening. For many of my patients, the getting to sleep is not as much problem as getting through the night. Often there will be some brittle middle of the night experience where they wake up. We have naturally a cortisol rise around 3 a.m. And so it's easier for, especially if you have to get up to go to the bathroom, it's harder to get back to sleep around those times. Does that resonate with anybody? I think I saw a couple of nods, waking up in the middle of the night. Thank you. So just quickly with that, I often, and I can do a talk separately on sleep hygiene if you guys would like, but a few of the strategies I recommend with sleep hygiene is a fancy way of like saying maximize your behaviors around your sleep to try to help your body's natural ability to rest come forward and let the interaction with stressors and other activities of the day recede. So we want to maximize those things by having a consistent routine toward bedtime, especially. Most of us are probably creatures of habit more than we know. So we probably do the same things roughly in the same order. But in case you don't, if you can be intentional about that, and when you do them in the same order, please operationalize them so that they are as consistent as possible. And they recommend that your bedroom be cool, dark, without blue light. That's the light from screens like TVs and computers. And then reserved just for sleep and intimacy, so that your bed doesn't inadvertently get associated with other experiences like paying bills or checking emails. Or many people like to watch TV in bed, and I understand that's a pretty human experience. Just be aware that your brain may then associate that with not only some entertainment or other expectation, but it also, with the blue light, it stimulates our pineal gland, which is like sunlight, and regulates the sleep-wake cycle. So it may inadvertently keep you up a little more than you want. The last thing I would add, when I'm going to bed at night, usually my kind of secret sauce to this is once I follow my exact same routine and I've front-loaded my activity and stress contact as much as possible in the day, so that I have lowered kind of on that natural descent towards sleep. I'll have a lower stress, ideally lower physical activity, so I can have a gradual descent toward rest, and then a habituated set of behaviors as I get prepared for bed. But the last thing that I do, I found really helpful with my patients, is I will pop in an earbud. I sleep on my side, so I just pop in one earbud. And then I put on the same guy on YouTube, my favorite person, that does regularly some guided meditation or visualizations. I honestly don't need it at all as I'm going to sleep. I am so exhausted from the day, I usually tap right out. In fact, often I'll wake up with my earbud in my hand. But when I was training myself to do this, I made sure I got the earbud in and hit play on something I just saved to my favorites, so it was easy to find. It didn't matter as much on going to sleep for my ability to get to sleep. When it really mattered for me was in the middle of the night when I would wake back up, so that I try to keep the lights dim, not wake myself up any more than I had to going to the restroom or whatever you need to do. And then as you're getting back in bed, following those same steps in the same order, and then giving yourself the same auditory stimulus can help your brain be cued that sleep is the next natural activity to follow. So if you habituated on your way to sleep the first time, especially if that's not as challenging, that can help kind of share that experience with your brain in the middle of the night. So that's my hope, that can be helpful for you. And I want to keep an eye on the time and recognize here, so you probably get a sense of my personality, but I'm so enthusiastic about talking about these things. I could go on much longer, but let me briefly say, I mentioned here on the proactive management for coping with these symptoms, trying to prioritize activities, and I just mentioned briefly, like sleep hygiene, for example. We can plan all we like, and then as we encounter realities where they may not match our expectations internally, this is when it gets interesting and challenging, right? When things don't go our way. And I put here flexibility, cognitive and behavioral, so both in our thought processes and what we're physically doing. That is helpful, but that is hard. And that is hard when we recognize patients with autoimmune hepatitis are already prone to depression and anxiety. We know that that is more prevalent. In fact, one study showed anxiety was twice as prevalent, more than twice as prevalent in this population than in the baseline population. So in other words, for your neighbor who doesn't have autoimmune hepatitis, you're twice as likely to have worry. So now we've got challenges that tend to fuel or exacerbate depression and anxiety. This gets really difficult. So I recognize it's not so easy to just say, well, be flexible, let some of your things go. If you have challenges getting to the dishes, let them build up. That may be okay for one person, but for other people, that may just drive them crazy and feel like that synergistic cycle, like I'm already not feeling well and now I can't get things done, or I can't get my environment to look the way I want. And I'm here more often than I would otherwise be because I'm not feeling well. And now I'm supposed to just be flexible and live with it. So this is where I hope psychologists can be helpful, but I recognize that that's a very significant challenge. Let me just add here, I think of these in terms of kind of like I mentioned, the concentric rings before of support. We can also think of these symptom layers as like concentric rings relating to one another. Fatigue, I mentioned before some statements about how profound it was, but it was described as the most profound symptom in several autoimmune disorders, for example, multiple sclerosis, and found to be super profoundly related to quality of life impairment. And I've just got some stats on here to share, and you guys are probably aware of this, but patients with autoimmune hepatitis were found in one study to have a much higher endorsement of mood and anxiety symptoms than the baseline population, with as many as almost 20% endorsing moderate depression, 11% endorsing severe depression. These are alarm signals. These are things we want to attend to urgently or in a very timely manner. Anxiety, similarly, much higher than the baseline population. So we are aware people are in distress, and physically and emotionally, and we want to attend to that. I would add it's often challenging to connect to attending to that with your social support team. They may, number one, not be able to see the symptoms that you're experiencing, and the fact that they're not readily obvious, for example, as compared to someone who's going through chemotherapy and loses their hair. That's an obvious external signal to someone that they're in medical treatment, and our society is, I hope by and large, cued that social support is appropriate when someone is in need. And so people may fall all over themselves offering a meal train or organizing someone to come clean or do their laundry. And I have many oncology patients who are thrilled and grateful to receive that support. Unfortunately, some conditions where symptoms aren't as obvious externally, many patients feel really challenged when they don't get similar levels of support. And often that implies that in order to communicate their needs, they would have to verbally describe them or ask for that support, which is like akin to saying flexibility is helpful when people are already experiencing challenges with mood and worry. This may be extra difficult to do when you're already dealing with it inside yourself, and then to have to share it, many people feel it's stigmatized, or they feel private, they would prefer not to communicate their needs, or they're shy about wondering what the response may be. And many endorse indeed that they cope by minimizing their needs. They defer them, they just don't ask for help at all. They manage them independently, or they may communicate them but have emotional distress, like experience guilt asking for help, or guilt that sometimes they look like they don't need help at all. Let's say I have patients who have a handicap tag, and sometimes they are able to walk without obvious external difficulty, but other times that may be extremely challenging. And I've had patients who have been stopped by people in parking lots to say, what's wrong with you? And why are you using a handicap tag? Which just, is appalling to me. But people will actually stop them to say that. And if it's not obvious to someone else who maybe have issues of their own, I would add, with judgment or whatever's prompting them to ask in that way, that may be very distressing for someone to hear. Certainly during a recent pandemic, that worry about health conditions and the experience being private or socially isolated has been exacerbated. So that's been all the more difficult. In the interest of time, let me move forward. This will be put online. So let me just say it can be challenging with healthcare providers as well as support for all that we intend to do. At times, people may feel like it's hard to ask questions or sense as much support as they wish. But as we intend to offer that support, speaking on behalf of the professional community, people do better when they are offered formal mental health, at least availability. Certainly, it's very provider dependent. If you get someone who you feel is open and able to really get you as a person and be helpful, but ideally that person would be trained in health psychology and able to be sensitive to what's normative in the condition and then tune into what's going on for you in particular. Social support, whether that's within the healthcare community or separately, we know can be protective. In fact, there's boatloads of research around the degree to which just having positive relationships helps your immune system. For example, I included here from a famous study called the Rosetto Heart Study that showed that people who had close-knit social ties had 87% less heart disease. We know people live longer with health risking conditions like cancer, or they have more robust immune responses. And I would add, during the pandemic, a study came out that compared, I thought this was just a profound way to say it, it compared social isolation. Remember when people were kind of like holed up in their own spaces and they didn't have contact in the community for a prolonged period of time? An MIT study came out comparing that in the brain effects to starvation. And I thought that was so helpful to make this point. Social support is incredibly important. Now, that can be communicated in lots of ways and in health protective ways, including virtually. But it's still super vital to our brains and to our immune system, and of course, to our psyches. So what we want to do is what I call stacking the deck, enhancing protective factors that are within our control. Here's a list of what are called the golden traits in terms of personality and some health behaviors here, things that you can do that we know enhance immune functioning and enhance psychological outcome. When you engage hope or optimism, a sense of control, not that feeling that things externally are happening to you, but rather focusing on places where you can exercise what we call agency, a place to have a voice or register your opinion and attempt to affect an outcome. Trusting your ability to affect that outcome and having kind of the determination and resilience to continue despite challenges. By the way, expressing your reaction to those challenges is also health enhancing. So you don't have to like everything. You certainly we don't expect a positive emotional response to everything, but expressing what happens when you don't feel good is associated with better immune response and better psychological outcome, as opposed to keeping your emotional upset unexpressed, not engaging problem solving, or your efforts at engaging your resources toward an outcome. And even though they're human experiences to feel this way, continuing to stay in a place that's dominated by a perspective of helplessness, hopelessness, or loss of control, we know tends to lead toward depression and anxiety. So How we apply these, I want to again keep an eye on the time, but we would in brief want to engage, as Freud widely espoused, places where we have meaning and connection, including connection to purpose. Connection to people is important, but also connection to a sense of why we're here. So I wish I had lots more time to go into detail on these. I want to just super quickly outline. This is called the biopsychosocial model. It's in effect describing human experiences at the center. There are 3 buckets of factors, just overly simplified, that we would group contributors into. And along those lines, we would I'm making here recommendations on what to do that can enhance your experience from each of the corners. So from the physical corner, to the degree you medically can, engaging in some gentle movement. Personally, I use a yoga for seniors app actually online that just allows for modified physical behavior, but still gives me the chance to stretch and do yoga that feels good. And to whatever degree my body can do it on a given day, I at least give myself the chance. I mentioned some sleep protective strategies earlier, and then creating behaviorally a sense of routine and structure to your day, and enhances our sense of what I mentioned before as locus of control. From the psychological corner, I've already described some of these at least a high level, but being connected to purpose, having self-compassion, and then exercising cognitive flexibility. Recognizing how we perceive things is the ultimate reality. So just because something happens doesn't mean that will necessarily have a specific impact. How we filter it in terms of our thought process is the part that matters the most. And there's some realities that just, are regardless, but most of them we can at least add a filter of our thought process. And psychologists will help people shift their thought process by engaging, this is kind of the heart of cognitive behavioral therapy, but what we call cognitive restructuring. It's like shifting a camera lens. So we could help with several different techniques, but basically trying to focus on things that are also true, but associated with better emotional outcomes. So it's still focused on truth. Like if we were looking with the camera outside, I could shift to focus on the blades of grass or the panorama of landscape. Both are realities outside my window, but where I spend my focus is likely what's going to feed my emotional outcome, which larger is mood. And within that, components that are negative give rise to negative features of mood, like depression. So we want to shift our attention and focus to help land in that positive place. Worry scheduling, by the way, is another technique. You can intend to focus if worry feels like a process your brain engages doing, and there's a biological substrate to that too, by the way. But when we do that, it can be helpful to kind of challenge ourselves to stay disciplined to do so in a specific time for a couple of reasons. It obviously limits the time you spend total with worrying. If you're going to say, I will spend, 4 to 4:30 on Tuesday afternoons focusing on all of the long-term concerns, for example, about my health. But it also trains your brain with discipline to defer thinking about that until your planned time. So if you can get into that mode, that's just one technique, for example, but I've got lots more where that came from, but just to give you a taste at least. And then from the social or behavioral corner, I will just very quickly often recommend to people that they develop some purposeful activity in a couple of arenas so that depending on how their body's doing, they can engage them. So I'll tell people head, hands, and whole body. Head being mental processes, like something you'd like to learn about. I mentioned, by the way, here PTSD support, because we found that this is helpful even in super severe psychological symptoms like post-traumatic stress. Manual would be something that you do with your hands that can give you a sense of control over your environment, satisfaction or closure, and obviously distraction. Whole body activities could be like exercise or volunteering for things. And then I very lastly, just since we're pressed for time, I will rush right on to tell people I always train patients in anxiolytic breathing as a health behavior. So this is, we obviously all know how to breathe, but this is a specific breathing technique that helps flip our brains from the fight or flight response or autonomic arousal to the relaxation reflex or de-escalation from autonomic arousal. So this just super quickly, I teach to the rhythm of 3, 3, 5, in through your nose for 3, deep diaphragmatic breath, that's like a balloon under your ribs, held for 3, and then exhale through the lips to the count of 5 or longer. And I'll have my patients proactively do that, ranging from 5 up to 15 minutes if they can, 3 times a day. If you can't manage that kind of time, even pairing it for a few seconds with an already adopted behavior like hand washing can still activate that relaxation reflex in the brain. So every time you go to the bathroom, if you just allow yourself to do that deep anxiolytic breathing, you will then automatically, at least several times a day, help de-escalate your brain out of that stress response. So I'm trying to help support doing what you can with what you have. Again, I call this stacking the deck. I'd be honored to come back another time to talk at greater length, but I recognize the resources you have are unique, profound, and what you're offering each other, even though today's been not as focused on that interaction amongst yourselves, I am expecting that what you do with that in other meetings is going to have an incredible impact from that biopsychosocial model. This is via the social support end, and also affecting people from a mental support end. So I hope that that feels robust for you. I hope that you are coping well with your symptoms, despite what I imagine is a pretty challenging experience. And I'd welcome any questions. And thank you so much for having me.